Welcome to the bonus content for the plantar fasciitis episode. For this content, what we're going to talk about is we're going to discuss the toe yoga, and luckily Sandra will be doing the toe yoga because she can actually do it a lot better than I can, so that's a better example. And then we'll talk about taping the arch, some different taping ideas, and then we'll also talk about some mobilizations for the midfoot and for the ankle joint that you can throw in for your plantar fasciitis treatment. So let's get rolling.
You're going to have your patient start with their feet flat on the treatment table or flat on the floor. They can do this sitting on a stool, or they can do it sitting on the treatment table, whatever's more comfortable for them. And there's a series, it doesn't matter the order, but I'm just going to go starting with the great toe. So for this one, all you're going to do is have them lift their great toe into extension without the other toes matching. You can either have them do one foot or you can have them do both feet together. And the goal is to let these four toes relax. Now, sometimes that's hard for some people, so you can have them just put their fingers down to help guide just the big toe to be doing that movement. And parameters for this, I'm going to have them do 1 set of 10 just to start. After that, I usually have them relax the big toe, and we're going to have the 4 toes go next. So I'll have 4 toes lift, and then 4 toes down. Same thing, you're going to want them to do 10 of each. And again, if they need help with guidance, they can hold down their big toe and let the 4 toes go. The next one's really fun. It's toe splays. So you're going to have them flat again. There's a starting position, and then you're going to have them try to spread their toes as wide as they can, and then come back together. So spread those toes, and back together. This again, reps 8 to 12, but I usually just stick with 10. And then the next one is a little bit more advanced. Actually, the next few. So this one's called monkey toes. You want to keep these two, so your big toe and your pinky toe down, and the middle 3 come up. It takes a lot of good control, and it gets some really good intrinsic muscular activation. Those are monkey toes. And then we'll go into piano toes. So piano toes, there are 4 different variations. You can start with all the toes up. And then this one's the easiest, so you're going to start with the pinky toe, and then move 1 toe at a time, going down onto the table. So then the 4th toe, the 3rd toe, the 2nd toe is usually the hardest, and then the big toe. And then you can just either have them do that again, so piano toes starting from the outside going in, or you can do, once you do that down, you can have them reverse it. Start with the big toe, go with the 2nd toe, go with the 3rd, go with the 4th, and then up. So again, you can either have them reverse it, or you can do the individual movement starting with toes down and then going toes up. The reverse is really difficult, so it would be first toe or great toe, and then the 2nd toe is the one that's hardest to move. Usually it likes to move with that 3rd toe and then going down, and then you can reverse it starting with the pinky toe. This one's hard for me. Pinky toe, 4th toe. Oh, yeah, you get the idea.
So these exercises are important to strengthen the intrinsic foot muscles. Those with plantar fasciitis pain have been shown to have a decrease in intrinsic foot muscle volume. And then these kind of strengthening exercises for it have been shown to increase that volume. So essentially the volume of the muscle is kind of a surrogate measure for essentially the cross-sectional area. So the more volume, theoretically, the more muscle mass that's within that muscle.
For arch doming, I usually like to include this, although it is not a typical toe yoga exercise. I do like to include this in when I'm working on the arch. So you're going to have your patient imagine the 3 points on their foot, 3 points of contact. So you have your heel underneath your big toe and underneath your pinky toe. I have those 3 then go into the table, and those are the 3 points of contact that I want them to be thinking of as we're working on this. And then usually I'll point out where their arch is and point out what they're supposed to be feeling for, what they're supposed to be looking for. So if they really work well with feeling that muscle, then I'll have them put a finger there. If they do better visually, I'll have them take off their sock and watch what happens when they arch, when they dome. So what I say to them is I want them to get those 3 points and bring them together. So without moving any of them off the table. So pull them together. You should see this pull up and get that dome. A lot of times, the first time someone does this, their toes will scrunch in. And then that's when I give the cue, hey, this point has to be on the table. And although their toes might still activate, then I'm still getting this arch that is lifted up here. So again, dome here by pulling these points together, relaxing those toes. And you can do these for 3 seconds, 3-second holds. And usually I do, again, I'll probably start with about 8 of 3-second holds, and then I'll move up towards 10, 12, depending on how people are feeling.
So now that we went through the strengthening with the intrinsic foot musculature, now we want to talk about some of the joint mobilizations that you can utilize when treating someone with plantar fasciitis. So as we talked about in the episode, one of the risk factors or what could be causing the tension on the plantar fascia is limited dorsiflexion range of motion. So one way that dorsiflexion can be limited is in the talocrural joint if you're not getting enough of a posterior glide of the talus. So a nice way to do that is to just do a posterior mob of the talocrural joint. So from what we all remembered in school, right, the convex concave rule, and then obviously the plane of motion that you're trying to mobilize into, I like to get them kind of like in a neutral position, or kind of right through here, a little distraction, and then you can just do a nice little posterior glide, go into like your grade 4 mob, and then just kind of hold. If you're trying to increase range of motion, and hold about 30 seconds, should be able to get you there. Doing it this way, like where your hands are nice and close, is commonly taught, but what I've noticed when we're trying to do a mobilization like this, a lot of times they like to bend their knee. So what I've started doing now is to keep them in neutral. I have their foot on my leg, my hand still right over the talus, and then I'll actually stabilize up here, like right on the tibia, and then I just do my mob that way. Now, for when mobilizing the midfoot, it kind of is going to depend on what you see in the patient. Do they have a pes cavus or a pes planus? Most people that you'll probably see with plantar fascia pain probably tend to be a little more pes planus, so you're trying to get them out of that pronation, going into more supination. So I would say definitely go off of what your evaluation tells you about how the mobility of their midfoot is. If you are seeing restrictions in the cuboid, it's a good idea to mobilize that. There's different ways you can do it. You can stabilize, so you'll stabilize the ankle joint, and then you can do simple just like an anterior or a dorsal glide, so kind of pushing that cuboid back. That's kind of just going off of one plane. You can also get your hand where your web space is right over the cuboid, and then you're almost trying to rotate it into supination. So you'll be here stabilizing, and then you get that cuboid and kind of rotate it that way. For the navicular, this will be very similar. Same thing, you can kind of come through here, get where that navicular tuberosity would be. And you can, same thing, you go through one plane, you can do your dorsal mobs that way, where you're just literally on the plantar surface of the navicular, and then just kind of mobilizing it that way. You can also kind of do something very similar to what you were doing with the cuboid, getting that web space right over where the navicular is, and then pulling, basically rotating it into that supination. So as we discussed in the episode, another very effective way to manage pain in patients with plantar fasciitis is adding the short-term effects of a tape application to help take strain off the plantar fascia. So there's different type of ways you can do this. Everyone kind of has their own little flair to it and what they like to do, what they've seen. In general, they all follow the same basic principles. So the first thing you'll do with your tape is you're going to add an anchor right over where the metatarsal heads would be. There will be your anchor. For it to lay down nicely and just a little more patient comfort, I always split the ends so it doesn't fold up too much. Kind of lays nicely across the arch. And then you'll add a second anchor right around the foot. Essentially, the idea here too is it's mimicking bringing the calcaneus a little bit closer to try and shorten that arch. And it also gives a nice base or a nice anchor for the tape to lay as you make your teardrops. So there's different ways that people like to lay down their teardrops. Some people like to go like this, where they basically kind of meet where the metatarsal head would be, and they go through each one. And you can go through there. Essentially meeting each one, each metatarsal head. That's one way to do it. And then you can add your cover strips, pull immediately. One way that I know I prefer to do it is I like to go and basically go around and then close it in. And I'll show you right now. Here. I basically will go from this metatarsal head around to that one and then kind of fan it that way. Yeah. So now I created basically recreated a plantar fascia underneath her arch. And then what you'll do is now you'll add your cover to it. And when you're filling it in like this, it's always important to make sure, as we know with like ankle taping, to keep tension off the fifth metatarsal. All your tension should be coming through that medial longitudinal arch. So I'll come through. And I like to really crank on that medial side and add a little bit of support. Another way, you can use different types of tape for this. One way that I like to do is I like to use Leuco tape as well, especially if you don't have a lot of time for some athletes to actually go through each teardrop. Going with Leuco tape around the arch is very effective as well, since it is a stronger tape. And I just really focus my tension where would be the navicular at, and then I pull up from there. So there are a couple ideas of how to tape the arch to help take some pressure off of the plantar fascia and help reduce strain and hopefully reduce their pain as you are rehabbing your patients. So another area to mobilize that isn't very common to think about, but what we mentioned in the episode, is the possibility of mobilizing the great toe. So if you don't have a lot of mobility in the great toe, a common compensation to get that motion as you're starting to progress through your walking gait is to start going into more inversion, which can definitely change how the plantar fascia responds. So the mobilizing hand is going to be on the proximal phalanx. You're going to stabilize the first metatarsal. And what you'll do is you'll mobilize in an inferior direction or a plantar direction. And then same thing as with the other mobilizations. If you're trying to go for a change in length, you want to do a sustained hold for your grade 4s. So about 30 seconds, you can do 3 sets. You can also add oscillations if it's more kind of like discomfort in the area. You can add little oscillations there to get the mechanoreceptors in the joint going. So hopefully this video gives you some ideas to work with when you're thinking about rehab for plantar fasciitis, some different treatment options to help with pain as far as like the taping goes and the mobilizations.